Rehabilitation forms the most important part of any surgery, or for that matter any treatment, especially for cancers. Now the reason is that if you don't rehabilitate these patients well, it becomes difficult for them to return back to a normal life. It becomes difficult for them to lead a normal social life. I am Dr. Snehal Shah. I am a head and neck robotic throat cancer surgeon based in Mumbai. Rehabilitation has often been an ignored subject by all the clinicians, but it is the most important part for a patient. If we need to if we need to make patient come back into a mainstream, then not only physical rehab but even mental rehab is required. But focusing on a physical rehab, as question asked, we can put a dental implant. Suppose if we remove someone's mandible, in case of a jaw tumor, we can replace it with a bone and implant which we can place during surgery itself and give them a teeth maybe after 12 to 14 months after completion of radiotherapy. Or if there's a benign tumor of the jaw, we can do it there and there itself, what we call as a jaw in a day. Now coming to guide bite prosthesis, now this is very crucial part for patients, especially for those tumors which have involving the posterior or the behind part of the bone of the jaw. This is a part, if we remove it out, as it is involved in cancer, the opposite jaw, the jaw from the contralateral side or the opposite, will be pushed to the same side. This is going to prevent, or this is going to cause a malocclusion. Malocclusion will lead to patient not able to chew the food because there is no alignment between upper and lower teeth. Now to prevent that from happening, we can put a guide bite prosthesis with the help of prosthodontist, who will now devise taking impressions, make a guide bite prosthesis, and with that will prevent jaw from sliding to the contralateral side to the same side. Once that is done, patient can chew well, the bite will be maintained. So that prosthesis which is known to guide a bite is guide bite prosthesis, which is very crucial. But for that, again, the prerequisite is that the mouth opening has to be adequate. So when we do a surgery, not only should we remove a cancer, we should also look out for ways to improve the mouth opening. Once the mouth opening has improved, it is easier for dentist or for that prosthodontist to give them the guide bite prosthesis. So to conclude, rehab is the most important part but often ignored part by clinicians. Surgery done, radiotherapy done, patients are ignored. No, they should not be left to their own. They have to be given adequate rehab, either physically or mentally. Thank you.